What I'd love to do is just start off with an introduction, and it would be awesome to kind of go in the following order. So we'll have Guidehouse go first, then L.E.K, Simon-Kucher, and Stax. And if y'all would just introduce yourselves, tell us a bit about your title, your firm, and something about what is particularly interesting at the moment, rewarding, interesting about working inside healthcare and life sciences. I do know also that we have recruiters from each of your firms that are here, but if you can also just specifically mention hot areas of hiring and whether or not you hire for internationals, totally fine if you don't, and also great if you do, but I would love to just know so that everybody can have those questions answered as we dive into the more interesting pieces of the material. So we'll kick off with you, Guidehouse.
Perfect. Very happy to be on this panel today. So thank you to Jenny Ray and the organizers for this opportunity. My name is Yubi Nok, and I'm a partner with Guidehouse Life Sciences based out of Boston. I've been with Guidehouse for 8 years, and prior to Guidehouse, I was with Simon-Kucher and Partners for a few years, although I don't believe Tyler here and I overlapped. And before that, I did my PhD at Harvard in cancer cell biology before transitioning to the consulting side of life sciences. So Guidehouse is a newer company, so I always like to give a little bit of our origin story. And you might have all heard of a company called PwC or PricewaterhouseCoopers. About 6 years ago, the public sector arm of that company lifted out and made Guidehouse. Then along the way, they acquired a company called Navigant to supplement the public business with a commercial business. And I came to Guidehouse via the Navigant acquisition along with the rest of Life Sciences team. Fast forward 6 years, and we're a global consultancy with about 18,000 employees all over the world, one of the largest healthcare consulting firms in the world. So for me, as a consultant in the biopharma space, when I was looking to transition and join Guidehouse, a couple of things stood out to me about Guidehouse that I'd like to share with the attendees here. And one is the fact that we in the life sciences team that work with biopharma clients, we sit within a much larger health segment. So we have colleagues in public health that work with the government at the federal level, so CDC, FDA, NIH, so on and so forth, as well as the state and local levels in addressing things like the pandemic. And we have other colleagues in the commercial business that work with payers and providers, so health systems and hospital systems. So this creates a really unique 360 environment where you have sort of all of this expertise in-house. And sitting on top of this expertise is the theme of collaboration. And we take that word actually very, very seriously here at Guidehouse. And our model really encourages us to work together, collaborate to solve for bigger and more impactful issues for our clients. So the reason I'm here is that we're in life sciences growing very fast and also have very ambitious goals as well as we look towards this year and beyond. And this creates a really entrepreneurial environment where we can all grow as employees of the practice. So please reach out if you're interested. And I believe, Jenny Ray, your question is what do you find sort of rewarding or interesting about life sciences consulting? For me, it's sort of the people that I had the privilege of working with within Guidehouse and to really grow with the team and the type of impact we can have together as a team on just the healthcare industry in general and see that impact in real time. So I'll leave it at that. Oh, one last thing. So we currently don't sponsor new work visas for international students for US-based positions. A key exception is for those with doctorate degrees, so PhD, PharmDs, and so forth, who would begin to work post-graduation on an OPT. If you do fall in that bucket and have additional questions, definitely reach out. So I think I have covered off on all your questions, hopefully, Jenny Ray.
Awesome. Thank you so much. Really great information. Fantastic. We'll move on.
Am I next, Jenny?
I think we'll let you go next, Dr. Matt.
All right, I'll sneak in. You set the bar high. Hey, everyone, great to meet you. I'm Matt. I'm a managing director at L.E.K. I've been part of our team for, I don't know, somewhere over a decade now. I come here after having finished a PhD and spinning out my thesis research into a startup. and realizing I knew nothing about how a business runs or even what a business is, and thinking I would kind of treat L.E.K as a 2-year mini MBA and stopover. I forgot to leave, obviously. I'm still here many years later. I'm really enjoying my time, and I'll get into some of that in a second. To the firm, for anyone unfamiliar with us, we're somewhere around 2,500 to 3,000 employees strong worldwide, over a few dozen offices. We've been operating for over 40 years. We spun out of Bain a long, long time ago, and marketing hates when I say that. But one of my colleagues recently published a book on it called The Best Job in the World, documenting our history and where we came from and telling a little bit of that story, which has a whole bunch of cinematic elements in the spin out. So I'll leave that aside for now. At this point, we're a general purposes consulting firm. We work on everything from shoes to advanced pharmaceuticals. My whole life is spent on the pharmaceutical side of the business, within healthcare, given this call, where I advise biotech and pharma clients on all sorts of strategies issues. When I think about what's most rewarding about my work, I normally tell people two things. One is, and I'll echo you being on this, I love the colleagues that I work with here. One of the two things that's kept me here for so long has been the folks I work with. The other is the type and breadth of work I get to work on. Uh, Over my 11 years in our healthcare group, I've worked on everything from kind of emerging couple $1 million raised early VC startups to one acquisition that was a $50 billion mega merger, kind of front page of the news type thing. And so I've really got to see the whole spectrum over my career here, which has been incredibly rewarding. To whether we hire international candidates or not, it's role dependent. At the PhD level, we do. For some advanced candidates, we do sponsor. For early individuals starting out, typically the answer is no. But you'll have to refer to our website on a kind of position by position basis for that one. Great, great to be in touch, and I'll add a bit more here as we go along.
Awesome, Matt. Thank you. Really fun. Let's move to Simon-Kucher now.
Excellent. Hi, everyone. I'm Tyler. I'm a director with Simon-Kucher. Come from a background of biomedical engineering personally, did undergraduate and graduate degrees in that space, but also worked in finance for a little while, working for banks. And so made the decision that healthcare life science, though, is really the spot for me. And just because of an educational interest originally, but have had a lot more time in this space. And at this point, found Simon-Kucher because of some of the things I'll share in just a second. But the main thing was that my ability to focus in a lot on medical technology, medical devices. So Simon-Kucher, though, as a whole, is a generalist or overall strategy consulting firm, global nature, 2,000 to 3,000 employees total, but have a specific life science and healthcare focused division. Within that, I specifically focus in on medical technology organizations, whether that's healthcare IT, diagnostics, medical devices. And our Simon-Kucher as a whole comes from Europe originally, spun out of university there, where the focus was on top level growth organizations. So how do we grow revenue? And so you might see in the insignia on here, unlocking better growth is the thing that we're really focused on, whether that's a sales, marketing, or pricing topic, making sure that our healthcare and life science organizations grow effectively, which gets into why I'm really interested and engaged on this. Specifically, we're helping to organizations to take these ideas from a research standpoint, making sure that they have a commercial plan and approach that'll make sure that these breakthroughs on technology are actually used in real world patients. The best example of this is a project where I was working with an organization on a cardiovascular device that they were trying to launch and figuring out how do they launch it effectively. And fast forward 5 years later, and my grandma actually receives that device and it's still working with her today. And so seeing that real life impact of taking something that's a great piece of research, a great piece of technology, and making sure that a business is actually prepared to bring it to the market is really rewarding for me. As it relates to recruiting, have a similar responses to the others. We do have some international sponsorships for roles within PhD or advanced hire or experienced hires. But for some of those undergraduate positions, it's not standard right now, but it can be evaluated case by case. And Laura in the chat can help clarify anything on that front.
Awesome. Thank you so much. Last but not least, Matt with Stax.
Hi all, nice to meet you. Matt McMillian, I'm a director here at Stax. I've spent most of my career in healthcare and healthcare consulting, about 15 years in healthcare and 10-ish now post MBA, it's hard to believe, in healthcare investing specifically. So my background is I've worked in the mid-market, I've worked in the mega cap world, I've worked on the corporate strategy side. I've seen kind of the full life cycle of deals, and we are deal focused here at Stax. So buy side, sell side, mid-market, mega cap, everything. I'm at Stax because Stax is kind of purpose built to serve the middle market. And so we are serving critical problems for investors. We've got with a thoughtful scope. And I'm here because I believe in the trajectory of that middle market in healthcare investing. And I'd like to be a partner in moving the needle for investors. So if you think about what drew me to healthcare consulting, I believe, frankly, and I say this to new folks who aren't healthcare focused that work on my deals, the U.S. healthcare system is a mess, right? It's difficult to navigate. It's not optimized by any way that you would design it. I think it's a major issue for the country as a whole, and I'm excited to be participating in the capital allocation that moves the needle, that probably moves us at least, I'm not going to say it's going to be perfect, but we're going to move more towards perfect than we are today. And so, yeah, that's why I'm excited to be here and excited to do my job every day. When we think about Stax, Stax is a small firm. We're hiring at all levels, including international candidates on a case-by-case basis. If you are a structured thinker and you want to solve kind of real-world problems for investors in the middle market, this is a great place for you to be. And I would say especially, we'll talk about this more today, but as you think about picking a lane in consulting, as you think about going deep, where you can be impactful, healthcare is a good place to be. So looking forward to the conversation.
Wow. Thank you all. Great personal experiences, awesome context for the background. We'll dive now into a couple of more specific questions around what's happening in the industry, some of the projects that you're working on specifically today, and also advice that you have for people that are interested in joining. So I want to start out, Matt from L.E.K. I'll start out with you for the first one, and then you, Bean, if we could go into this for Guidehouse. I think my first question comes from right, Matt McMillian, you said this, I've repeated it, but in different words. I've said there will never be an end to the work inside the US healthcare system. I hope that that's actually not true, that maybe in our lifetime we will not see that kind of optimization, but it seems like every project, I mean, this was true 2 decades ago, that every project you completed in healthcare, by the time it ended, a new one needed to start. And it was some of the most durable business inside consulting. It was some of the most durable business from a career perspective, people that I knew that were in consulting and left to enter into internal roles. But I'm just really curious about where we are right now. What's one key industry trend that you're seeing right now, and how is it shaping the work that your firm does? Matt, could you go first?
Yeah, of course, Jenny. Let me ask a quick follow-up question. When you say industry trend, are you talking about healthcare consulting or healthcare consulting? Which industry are we most interested in?
That's good. Yeah. Let's talk about healthcare consulting. So the industry that is serving some of these issues inside the healthcare organization. I would imagine there's some dovetail, but there are some that are probably more top of mind that they're seeking outside counsel for.
You've got it. Yeah, no, there's a ton of overlap. So, to kind of answer that, the trends we're seeing in healthcare consulting are the two that converge from those other industries. What are our healthcare clients doing, and what is happening in the consulting industry broadly? I'll say on the healthcare side right now, if I had to pick one trend to highlight, I would focus on a real trend towards risk aversion, especially for new device and new therapeutic development. Capital is a little tighter right now. Clients are a bit more conservative than they historically have been. And I guess to try and bring it to life a little bit with a story, we published a lot of different white papers over time. And one we recently just put out was on the amount of consolidation into certain biological targets we're seeing in pharmaceuticals. And that paper has got picked up by banks, VCs. It's been all over the place because it's resonating with everyone. The number of new targets being developed is the lowest it's ever been, at least in decades. And you could see a real kind of herding mentality as everyone tries to go to the few safest places. So we spend a lot of our time right now counseling clients and advising clients on how to take appropriate risk, where to take risk, and how to make sure you're generating returns as a reward for that risk. If I had to highlight a more consulting-oriented trend, and I'll keep this one quick as I know you only asked for one, Jenny, I would simply highlight the impact AI is having on our industry. We're seeing it everywhere, but new tools are being developed every day. My team's deploying new tools every day to these problems. And I would certainly get familiar with that new paradigm if I was entering the workforce now.
Yep, and
Love
definitely
it.
agree with you, Matt. And not to repeat something that he's already mentioned, I'll add something different here. Not necessarily new, but has been a trend and a push for years now is value-based care, of course. So clients across both public and private sectors are really, continuing to look for ways to realign care delivery and reimbursement models, and tying that to patient outcomes and population health to be really with the question of, especially in the US, to Matt's from Stax point around the US healthcare system being broken, are we actually delivering value commensurate with payment and what we're paying? And just kind of tying that back to Guidehouse, we see this sort of theme impacting our work in a number of different ways, really, from helping our biopharma clients better define and communicate value of their products, to helping health systems redesign their care management model to promote workflows that are aligned to this theme, as well as with the government to sort of think through structured payment models that really promote accountability. So, I'll just sort of highlight this as a theme that we've seen and for years now, but also continuing.
Fantastic. Thank you. Well, Matt, you mentioned AI. Both of you talked about some structural challenges that are not necessarily new. It's one of the things I think that makes healthcare consulting so interesting. But I'd love to move over to Stax and Simon-Kucher. So, Matt from Stax, I'll have you start with this one. AI is a hot topic, right? How is it actually changing your day-to-day work with clients, if at all? How specifically? And then can you share a recent example potentially?
Yeah, it's definitely changing. It's moving fast. And I think about this from two angles. I think about what do the clients want? What's the demand side here? And how's it changing the day to day for associates and consultants and managers at these firms, right? And on the client side, I would say that the table stakes, the bar is a lot higher than it was even 2 years ago, frankly. I talked to a client yesterday. We pitched a deal to them. We said we're gonna run a diligence on this deal for you, and here's what we would do. And they looked at it and they said, "Yeah, but I can get like 80% of like what I need to know about the market size from ChatGPT. So why should I listen to you about it?" That was literally a conversation that happened yesterday. The answer is like they shouldn't have to pay us to do that anymore. The where we're adding value is bringing judgment and structured thinking and segmentation and deeper dives into the market than they can get on their own, right? And so the bar has been raised from the client side. That's my first point. Second point is internally, I think it's a more exciting time to be a consultant than when I started 10 years ago, right? Some of the kind of basic blocking and tackling has been removed to a large degree, right? We're elevating thinking of our associate consultants and our consultants. We're freeing them to spend less time taking notes and collating things and pulling quotes out of 100-page documents and putting them in decks, and encouraging them to spend more time thinking about the kind of big rock items that move the needle on what we're discussing, like what the important issues to the client are. And so I'm excited about it. I actually think it's a boon for the industry, because I think both of those things from both angles are elevating our work.
I love it. Tyler,
Yeah,
weigh
absolutely.
in.
Happy to. So to Matt's point, there's a huge amount of efficiency that our teams are getting from using AI tools when it relates to, okay, collecting information. that's naturally it used to be a really valued skill set. It's not maybe as valued of a skill set because these tools can help you collect information. And so from our teams, it's helping them with their secondary research information that they need to do to help make informed decisions. An example was a client was we were talking to them specifically about tariffs and how that's impacting businesses and what that's doing to other competitor businesses. And using tools, we were able to have AI tools. We were able to have really quick collect information really quickly on what major organizations are doing, how they're presenting that information to the market. And then it could then open up our team members to spend the time thinking through, okay, this is what a Medtronic is doing. This is what a big organization like Abbott's doing. How do you see yourself relative to them? Do you agree with those actions they're taking, and spending the time thinking through, is that the right approach for you as an organization, even to go with or against the market trend? So it's definitely helping hugely with efficiency and opening up team members' times to the things that are more interesting and more uniquely challenging, as Matt was talking about. Internally within Simon-Kucher, though, we're also setting up enterprise GPT environments, which allow us to then use these tools in a safe and compliant way with our clients' data. Say that they're sharing with us some very detailed information, we're able to use these tools in a safe way that's going to protect their data. It's not going to get built into new models that are being built by these organizations like OpenAI or things like that. And so for us, it's also not just how can we do this effectively, but also in a really compliant way that protects our clients and ensures that we're using these tools in a way that helps that helps our clients without putting them at undue risk or things of that nature from a competitive intelligence angle.
Tyler, I want to press on that for just a second before we move on, because that was actually one of our audience questions, and the wording for it was this specifically. Maybe you can just dive into what would be compliant and what wouldn't. And I don't know if you're talking about compliant in terms of judgment or if actual legal has caught up with this. I think that we're outpacing legal, honestly, a little bit right now. So some of it is just like honorable judgment versus legal judgment. But right, how is your firm helping clients make sure new tools like AI or digital health stay compliant with regulations? It was a real tactical question. Can you just give us a specific example on that before we move on?
Yeah. So a few years ago, when GPTs were becoming really popular, we had our legal team was giving guidance on what could or could not be fed as inputs into these types of AI tools as it relates to, okay, if we know something that is internal data information from the client, we can't be putting that directly into a GPT. Otherwise, that data is then being fed into OpenAI's or other organizations like Perplexity's learning and data modeling sets. And so instead, we had some very strict rules until we could set up an enterprise setup where now we have data agreements that are put in place with clients. It confirms where data that they share with us will be used or not used with AI. And we then have these enterprise setups where we've worked with AI tools, organizations that sell it or that are providing these AI tools, and they fence out our environments from others. And so it's a completely self-contained environment that we host and make sure that then we're leveraging the tools, but also in a compliant way that isn't potentially putting their internal data out there into the broader environment.
Sounds like the consultants have consultants. Is that what we're saying?
So we have legal consultants, absolutely, when it comes to these sorts of things.
Yeah, totally. That's one of my favorite follow-up questions whenever you say you're in consulting is, but what kind and to whom and for what, right? So thanks, Tyler.
Yes.
Yeah, that's good additional, a good build on that. We have a couple of questions that came in that we kind of shaped a few of our guided questions on related to our candidate skills. And I know the chat is just blowing up on candidate questions right now. So let me move over to these. UB, and I'll have you do this one first, right? What's one soft and one hard skill you recommend candidates start building now to prepare for a role in healthcare consulting?
Yeah, good question. For the soft skill, I'd emphasize structured communication. If you talk to enough consultants, you'll maybe notice that there are some commonalities in how we speak. We like to distill everything down to 3 bullets, maybe 4, 5 starts to make us a little bit nervous. I mean, I'm being a little bit, facetious here, but just being able to synthesize complex issues, complex problems, and communicate the insights that you have in a way that's clear to an audience that may not have the technical background that maybe you have, right? So that's sort of what we do as consultants, the storytelling piece of our job. So that's something that I would emphasize. For hard skills, I mean, data, being able to work with data, I think you just can't, in this day and age, we just can't get away from that. And even if you're not a data scientist, just kind of, doing your due diligence, asking ChatGPT about healthcare data sets and the very foundations of Excel, certainly, right? And I think we consultants in 2025, we just need to be comfortable with dealing with large data sets. So I would emphasize those 2 things.
I love it. Matt from Stax, what about you?
Yeah, so I think it's a great point around structured communication. I want to talk a little bit about, maybe this is taboo, I don't know, but willingness to voice uncertainty and doing that in a way that's not harmful to your career. I actually think this is really important. Some of the best relationships I've built in consulting, it have been via me either being willing to say, hey, I don't know what I'm talking about, and we're going to put this on the whiteboard and figure it out together, or somebody coming into my office and saying, I don't know what I'm doing here, and I can get a lot more leverage on this project if you help me, right? And so as you think about like the AC and the consultant roles, and even up to manager, senior manager for sure, in healthcare consulting, it's a hard subject matter, right? Not everybody knows everything. And I think being real, finding a way to voice uncertainty without like kind of sabotaging your career, and finding the ways in which you can do that, and where you can walk into your manager's room and say, hey, let's whiteboard this thing together and let's understand it together. That's super valuable, super valuable. On hard skills, I think this is simple, but it's just where does the margin flow in healthcare? How does healthcare finance work? When I worked at R1, which is a revenue cycle management company, so this is apropos for them, but they used to hand out textbooks on the first day. They would give you a healthcare finance textbook, like from an MPH program, and they say, just read the first like 5 chapters of this, and then come back when you understand how this works. And so that's something that if you're currently employed in consulting, if you're not, both of those things, just spending a little time understanding how the dollars move in healthcare, which is kind of unintuitive and not really the way it works in a lot of other industries in America. I think it's really valuable to give yourself a basic grounding in how that works.
Matt, I'm wondering how many people didn't come back. They were like, come back when you understand this. And then, 30, it's like a banking tactic from the 80s when they're like,
That's
come
true.
back when you make
Yeah.
your first deal, and just some people went away, right?
No, it's not that way at all. All I'm suggesting is you get a head start, because if I have to explain like how charges and contractuals and payments work to you on the first day of our project, well, we're a day behind. And this is just like kind of basic work that you can do if you're really interested in healthcare consulting. Read a healthcare finance textbook, figure out how it works. You don't have to read the whole thing, just have a sense.
Well, it's almost like cheating, because my next question, and I'll give you this one, Tyler, next, is just what do you look for on a resume that makes a candidate, especially one just starting out, stand out? So Matt, if you could just put the Amazon link to that textbook inside the chat, that'd be great. Then everybody can just apply saying like, I read the first 5 chapters of this, and you'll know that they were listening to you. Tyler, how can you build on that? What else do you want to see from people?
Yeah, absolutely. So one of the key things that always triggers that has been highly correlated with really strong candidates is people who have taken an active interest in consulting or consultant type activities in the past. If you're an undergrad, maybe that's an experience through groups or groups you're involved with in your university. If you're someone that's an experienced hire, it's explaining how your role is taking a larger problem, breaking it down into its components, and showing that you're able to solve through. And that maybe doesn't apply to everyone. Maybe not everyone has had those opportunities to have like a very consultant style experience in your life, and that's totally okay. That's not absolutely a requirement. And so if you're not having those experiences or haven't sought those experiences out, the other thing that I always try to look for and consider is how are you framing the experiences that you do have? Are you able to share how you work within a team? Consulting is always going to be team oriented in some form or another. And so having that exposure and framing what roles you played within team organizations. Um, yes, you're probably a very smart individual who can solve everything on your own, but that's not how consulting works in reality. So, making sure that when you look at your resume and how you talk about your experiences, how does it relate to some of the things that that the rest of the panel have already talked about in terms of are some of those skills, both soft and hard, that you've been able to demonstrate or do?
Tyler, can I just push on that a little bit more?
Of course.
Why does somebody having a consulting experience benefit you? What is it that you notice about that that changes the nature of what that candidate demonstrates in the interview or on the job later?
Yeah, most explicitly, it's some of the soft skills that Eubine and Matt mentioned. Traditionally, the people who've had those types of experiences have had the opportunity to develop some of those soft skills maybe further than their peers. And so that's a really that it in my opinion, it comes down to those opportunities and those experiences develop your soft skills, which make you a very strong candidate.
Good. Awesome. Matt from L.E.K, what about you? What's something that you notice on a resume that will really make a candidate stand out for you?
Yeah. Yeah, Tyler hit actually the first two things I normally look for. Rather than previous consulting experience, I normally broaden it to some sort of related business experience. I'll take startups or tech transfer too, but I think we're kind of saying the same thing. And then I like to see performance in their current role, some of what he said around how they frame what they've done. But if I had let me try and paint a picture of what it kind of looks like when I'm looking at a resume. I'm generally sitting down and I have a pile of applications in front of me. It's anywhere between 200 and 2,000, depending on the position. And I'm generally pretty focused and pretty serious about this. I know I'm looking at people's careers here, and this isn't like a task I'm trying to get through quickly, but that this has long-lasting implications. And so I'm trying to figure out what in there stands out. And as I go through them, here's what I'm likely going to find. Most of them have been pre-screened by Lindsay or my HR colleagues already. So a lot of the kind of quote unquote junk things that just aren't relevant are out. So it's 200 to 1,000 relevant applications. Within those, many to most are going to be from top schools, think top 20 programs. Many or most are going to have a 3.5 GPA in a relevant master, in a relevant in degree area, major, with relevant classwork. And so how do you stand out in that situation? And I normally, the things that normally jump out to me are the folks who have done something exceptional, where they're kind of an N of one on some axis. That could be if it's a PhD application, a publication in Nature. If it's an undergrad application, it could be leading the ballroom dance team. I had an MBA hire who was previously Miss India. But things like that kind of like jump off the page at you. And then when coupled with all those other things, are what really makes somebody unique. So as you think about writing your resume and standing out, think about that one thing that's uniquely you. Not where are you best 10% in the world, but where should somebody think of you first? And make sure that that comes off the page, that you really are exceptional.
Basically, all you have to be is the best. That's it, right, Matt?
Yeah. I would like somebody who thinks that they could be the best at something. Absolutely. Yeah. I know a high bar, but that's exactly what I'm saying,
No, but
Jenny.
it's great. Like everybody needs to know what the bar is. Otherwise, how can you clear it? You're just going to run into it every time. Good. I want to move to some of our audience questions. Thank you all for your really insightful answers and great stories. I mean, Tyler, I'm still thinking about your grandmother who received the result of the firm that you worked for, right? I mean, what an amazing tie-in. I want to talk now just to a couple of tactics. A lot of our kind of submitted questions were just around like really practical, tactical things. So the first one is, should I expect a case interview at your firm? And if so, will the case be about healthcare or life sciences, or as we often threaten people, it could be about hamburgers too. So, what is it that it may or may not be about if you do case interviews at your firm? This is just a round robin question, so jump in if you have something to contribute.
Yeah, for Guidehouse Life Sciences specifically, yes to both. So for us, there is a spot case, and it's, I would say, a shorter spot case than perhaps some of our other consulting companies. And we have a case presentation where the candidates are asked to develop a few slides and present and email those to our recruiting team and present on the day of the interview. And both the spot as well as the case presentation are specifically related to the life sciences industry. And there's the behavioral too, but.
That's awesome. How many people have you caught just doing the same ChatGPT prompt and having the same slides roll in the door? Is that a thing?
That hasn't been a big issue for us. However, I mean, with bullets and things that are on a slide, we are pretty good at catching on to ChatGPT cover letters too. So I would encourage everyone to sort of use it as a tool, but not as the sole tool, if you get what I mean.
Write me a presentation or write me a cover letter, but maybe like make this a little bit more like
yes,
boom, boom, boom.
exactly.
Yeah, exactly.
Yep.
Yeah, we in our case competition last year, we had over 100 applications that gave us the same response with at least some of the same phrases for who their favorite company was. Out of 250 people, over 100 said the same company with the same reasons, and we were like, how about that? So yeah, just pay attention to that. Anybody else case interviews at your firms?
Maybe one thing to add there is, yes, we do case interviews. Yes, they're healthcare related. No, you don't need to be an expert in that part within healthcare. We provide the relevant information in the case, so you don't need to be expecting the reason, or you don't need to become an expert within 2 minutes. The reason I bring that up is because there definitely are patterns we are seeing where individuals are trying to use GPTs and things of that nature to get results in answering questions to a case. And it's okay that you maybe aren't this expert in this specific part of life sciences. We're more interested in seeing how you think through. And also, it's incredibly obvious when you're reading prompts from a GPT, and it's pretty much going to end your opportunity at that firm. Probably, I speak for all of us here if we're noticing that, and it is quite noticeable.
This is the horror stories that I was looking for, guys. I'm really loving this. Matt, Stax, did you have anything that you wanted to add? I know that you came off mute at one point.
Yeah, we do have case interviews at Stax. We, however, are a generalist firm. We're still pretty small. And so your specialization in healthcare will come after you get here. And I welcome you to come work with me. It'd be great.
Love it. Let's talk about some of the questions that have been coming in the chat. This one was also pre-submitted for candidates without a science degree or a background. And Matt from Stax, I might ask you to actually take this one first, because I suspect that you, from what you said earlier, this is kind of more where you came. We have a lot of doctors on the call, but with strong skills in strategy or analytics, how do they stand out in the application process? Can you build on anything else that you've said so far?
Yeah, sorry, can you repeat the first part of the question?
Yeah. Specifically for candidates that are like, I think healthcare could be interesting. I'd like to solve problems in this industry, but I'm not a biomedical engineering major. I'm not a PhD in pharma, right? Like, so what are the things that I would be able to contribute here, and how do I emphasize those in order to stand out?
Yeah, it's truly the same as it is in any specialty here. If you're a structured thinker and you're willing to learn, I say it takes probably, at the kind of mid-market commercial diligence cases that I'm working on primarily, I tell people give it 3 or 4. It's going to take a little bit of time to ramp up your understanding of healthcare. But once you speak the language, you're going to be really happy that you picked a lane. You're going to be really happy that you specialize. It's going to make everything easier. It's going to make your path to partner easier. It's going to make your day-to-day easier. Can't recommend highly enough picking a lane or at least a major minor and kind of starting to specialize. And the only requirement for that, from my perspective, is that you're a structured thinker and that you're, bringing that plus a work ethic to bear on the case, and we're good.
I love it. So, and anybody else want to weigh in on that one? If you don't at your firm have a science degree or background, how do you stand out?
Yeah, I can jump in quickly too, Jenny. I think it comes down to knowing what your superpower is, again, what that one unique thing is. We have a lot of roles that are just generalist roles. So the life sciences degree isn't necessary here at all. You could come in on a generalist track. If you come in on a life sciences track, you could do it even as a generalist by background. And in that case, I would be emphasizing either probably your technical skills, programming, AI, big data, things like that, or your soft skills. We are a client-facing business, and if you could kind of position yourself as the client-facing person of the team, there's a path there. So think about what your superpower is and emphasize that, but there's definitely roles for folks who aren't life sciences nerds in healthcare consulting.
Yep. The only thing I'll add is within our practice, one of our strongest managers, he was a concert pianist before he transitioned to life sciences consulting. So like the point that was brought up before, we're not really testing or grilling our candidates for deep healthcare or life sciences knowledge. It's just the ability to think and the ability to communicate, really.
Love it. What's one hot take that y'all have about the future of the healthcare consulting industry? Products that you'll see that we don't have today, consolidation in the industry, changes around what your clients' problems are that they're solving. Matt, I love that you earlier brought in expectations from clients changing, but like if we were going to fast forward, I mean, honestly, 10 years feels like we're going to be living in a twilight zone at this point. So that feels too far, but let's say 5 years, right? 5 years from now, what's a hot take that you have about the healthcare industry and the healthcare consulting industry?
And maybe I
Yeah.
can. Yep.
Go ahead, Tyler.
Appreciate that. Yeah. So I know a lot of the folks on the call here mentioned that they're focused in the pharma space. I focus a lot on medical technology, and one of my hot takes is that traditional medical technology divisions and businesses are going to become less and less about the actual equipment and more about the wraparound software uh, and services that are provided around the medical technology. The U.S. in particular does not incentivize a whole lot of innovation in medical devices as much as it does in pharmaceuticals, which means a lot of medical devices are becoming more commoditized amongst different competitors. And instead, we're seeing a lot more of the competition on the types of software that go along with this surgical instrument that can help the surgeon. And so my hot take, I guess, would be that the successful medical technology companies are not just going to be traditional equipment, but more and more software oriented and wraparound services oriented.
I can go next. I spend a lot of my time actually working with clients in the cell and gene therapy space and helping them think through how to commercialize these scientific innovations. And if you think about the past 10 years, it's amazing how far we've come with medical science, right? The ability to specifically target the part of our DNA that's not right and fix it with technologies like CRISPR. And currently, we are sort of still trying to figure out how to commercialize these therapies and in a way that makes sense for all stakeholders, as well as how to pay for these when they are high cost one-time therapies versus a pill that you take every day for the rest of your life. So in 10 years, I hope and I predict that we will have figured out how to commercialize these scientific innovations, all with the goal of making sort of these therapies available ultimately to patients. So that's my take.
Yeah, we'll see a lot of changes in both of those directions. I totally agree. I mean, my answer here, I guess for a hot take, is uh, tied to a lot of the answers we've talked about already on AI, but I think the job is going to look very different 10 years from now than it does today. Over my entire career, information has become more and more commoditized. It's been easier to get to, easier to access, and easier to research. Those parts of the job are going to become trivially easy, and those lower level tasks are going to go away. I think there's still going to be a ton of value we add to clients, but it's going to be more on the critical thinking side and the client interaction skills. So continuing to polish those soft skills now while knowing how to leverage the tools is what's really going to drive folks forward. There may be some room for really technical folks to develop some of the tools too, but I think you'll see at most a bifurcation, at least a shift towards client interfacing for more and more junior individuals.
Matt, I think is a really great point. In my world, I'm a little less clinically focused than some of the folks on this call. I'm probably more on the financial side, the healthcare IT side here. But my hot take, if I had to give one, is that I think that based on this kind of information symmetry instead of asymmetry, that's like, as Matt said, is rapidly taking over. I think there's kind of like a detente between providers and payers, not because they like each other, they don't, but because it's as we automate things, it's going to smooth all those edges and it's going to make the back and forth so low and the friction so low that the incentives to fight all this stuff aren't worth it anymore. And so, in terms of financial implications for the U.S. healthcare system, I foresee a lot of that stuff changing over the next 5 years and definitely over the next 10.
I love it. Well, thank you all for your amazing insights. We'll wrap up now. It's your opportunity to kind of take the floor and say something that you haven't gotten a chance to say. The final question specifically is just one piece of advice that you have for everyone who's on the call. We have obviously a significant number of job seekers that are here live and then others that will listen to it later. We also have industry professionals that are here on the call today. So any kind of key piece of advice that you have as people are thinking about the future of healthcare? Eubine, I'll start with you.
Yeah, I can keep this short. I mean, I think wherever all of you end up, be proactive and take charge of your career. I think it's easy to fall into a trap where, especially in this sort of virtual world, you're at your desk at home every day, do what you're told to do and just close out for the day. I mean, I would take whichever organization you end up in, I would take the opportunity to meet people, maybe those people that you're not working with, ask them what they are doing. And I think you just get more out of your position with that mindset.
You started out the call by saying we could have been in person. And I think that 5 years ago, we were thinking the opposite direction. This could have been not in person. But I think we're beginning to recognize that in an information commoditized world, that those human interactions are really where some of the edge is gained. So I think you're exactly right about that. Tyler, how about you?
Yeah, I'll take this maybe in a slightly different direction in terms of advice for those here today. But if you're actively looking for roles within life sciences, like the one piece of advice is find a story or a reason that you can share with the organization you're interacting with on like why you're interested. That could be something as saying identifying a trend that you're really interested within life sciences as a whole and having some knowledge or proven that you've spent the time to try and understand that and why you're motivated to look into that part of healthcare or life sciences. It might not be the thing that you maybe work with that organization on in the first year that you're there, but it at least really helps us understand why you're motivated. Because as I started the call off today, we're really focused on helping to bring innovation to patients. And if you have a really strong oriented view on what you care about and what matters to you within life sciences, that shines through very strongly and makes it a very compelling case for you as a candidate.
Thank you. Matt from Stax.
Yeah, mine's be a good teammate. There's so many interesting people and just driven people in this industry. And I've vacationed with folks that worked for me. I've you know, been invited to a lot of cool things from people that I worked for. I officiated the wedding of one of the kids who was my associate consultant back in the day. And these are friends that I treasure. This is like there are a lot of cool people in this industry who are really smart thinkers. Uh, be a good teammate, and that'll get you really far.
Love it. Matt from L.E.K.
Think that makes me last. It'll echo a little bit what everyone else has said, but if I had to sum it up quickly, I'd say be eager. You know, whatever you're pursuing, make sure it's something you really care about and pursue it eagerly. Some of you are kind of wrapping up degrees or college right now and probably feeling very eager. Others might be further in their career, but I'd give the same advice either way. Make sure whatever you pursue, whether it's a career with one of us on this call or something else, something you're really eager about and that's going to energize you to get out of bed every morning. It shows up in everything you do and will really change how you perform in your career. So be eager.
I love it. Well, thank you all. What a wonderful session. I echo a lot of the comments in the chat. I think that our audience could have gone on for 6 hours, but I'm going to relieve y'all and let you head off to your day. Thank you for your insights. I learned a lot. I also just think that there were a lot of really great exhortations in there. The wisest people that I know and the ones that I love engaging with are the ones who write me afterwards and tell me what they did with the information that I got. So for anybody who's on the call today, if you're going to write one of the panelists, I'd encourage you to give it 2 weeks, do something with what they said. Go read the first 5 chapters of a textbook, go, develop a new insight that you didn't have before. And then reach out to somebody because those will really open up high impact conversations and relationships. The last thing that I just want to say is for anybody who is interested in joining us for the case camp in New York, and this includes our panelists or folks from your firms, we're really excited to be in person. I do think there's going to be an increase in in-person insights and some of the edge that's gained from those. So we're going to be in person just once this year in New York at the end of this month, and we'd love to see you there. Thanks everyone for joining.
Thank you, Jenny. Thank you, team.